Okay, good afternoon. Thank you for joining us for today's press conference. If you need access to record or would like to ask a question, please let us know in the chat. You do not need to tell us your question, only that you have one. Please also include your affiliation. We have 30 minutes for the press conference today and limited time for questions, so we ask that you please be considerate of others' time and only ask one question. If there are remaining questions when we conclude and you feel it hasn't been answered, please submit it in the chat or by email, and we'll get you a response in writing. We will begin in just a few moments after we grant recording permissions. Okay, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. And Dr. Vanderhoff, we'll hand it over to you now to begin today's press conference.
Well, good afternoon, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, the end of summer is upon us. If you have children in school, and for those of us in public health, back to school time represents an opportunity to talk about the importance of childhood vaccines. While the majority of Ohio's kids do reach kindergarten having completed all their required vaccines, we have unfortunately seen some decline in vaccine rates in the past few years, both in Ohio and across the nation. First, let's review what vaccines are required for school attendance in Ohio. For those entering kindergarten, they must have received the measles, mumps, and rubella vaccine, generally called the MMR, the DTaP vaccine, which covers diphtheria, tetanus, and pertussis, and vaccines for polio, varicella or chickenpox, and hepatitis B. Heading into 7th grade, students are then required to receive a booster vaccine covering tetanus, diphtheria, and pertussis, called the Tdap shot, as well as a meningococcal vaccine. And finally, entering 12th grade, a second meningococcal vaccine is required. Now, I mentioned the decline in vaccination rates. In 2019-2020 school year, 89.9% of the state's incoming kindergartners met all vaccine requirements. This past school year, 24-25, the percentage of kindergartners who met all requirements was down to 85.4%, or a drop of nearly 4.5% over 5 years. That means that thousands fewer incoming kindergartners are protected against the range of diseases that these vaccines prevent. Vaccines have been proven over time to be safe and effective. They're so effective, in fact, that some diseases have been determined to be eliminated in the United States. And this may cause some people to think, hey, these diseases are a thing of the past. But these diseases can be and have been reintroduced into the United States, underlining the importance of fully vaccinating your child. Indeed, there have been too many examples in recent years of vaccine-preventable illnesses reappearing in our communities. If you have any doubt about these vaccines and their continued relevance, look no further than what we saw around the country this year with measles. Nationwide, the outbreaks appear to be slowing of measles or over, but through August 19th, across the country, there had been 1,375 measles cases, and 92% of those were in individuals who were either unvaccinated or who had unknown vaccine status. Now, measles can be very serious. Nationally, we saw 173 hospitalizations and tragically 3 deaths. In Ohio, our outbreaks are now closed, but we have had 35 cases this year, 33 of which were in unvaccinated individuals, and the other 2 people had unknown vaccine status. Thankfully, only 1 Ohioan was hospitalized and no one died. Now, I'm speaking in the past tense because the last Ohio case reported on May 20th, but clearly, measles can still afflict any of us, and in particular, those who are unvaccinated. The recommended 2 doses of MMR vaccine, though, provides 97% protection against contracting measles. Now I want to turn to HPV. Now, although they are not required vaccines for school attendance in Ohio, I want to mention 2 other vaccines that we encourage parents to consider for their children. One, of course, is the annual flu shot, which everyone should get this fall in advance of respiratory virus season. We usually start to see an uptick, by the way, in respiratory viruses in Ohio in the fall. The other is the HPV vaccine. Now, HPV is a common virus that infects millions of Americans. In most cases, the virus goes away by itself within 2 years of infection. But in other cases, the virus remains and can cause cancer. The CDC estimates that HPV causes more than 36,000 cases of cancer nationwide every year. The most common types of cancer associated with HPV are those of the cervix or genital areas, but it also causes certain types of head and neck cancers called oropharyngeal cancers. HPV is thought to cause 60 to 70% of oropharyngeal cancers in the United States. And these cancers are most often appearing in men over the age of 50. The good news is that the HPV vaccine is highly effective. The CDC estimates that the HPV vaccine can prevent 90% of these cancers. That is a striking statistic and the strongest evidence I can think of that parents should have their children immunized against this virus. In short, it is a powerful cancer prevention tool. And yet, according to the National Immunization Survey, nationally and in Ohio, only about 63% of 13 to 17-year-olds are in fact up to date with their HPV vaccine. And now, to help us discuss these important topics further, I'd like to bring in our guest today, Dr. Amy Edwards, Medical Director of Pediatric Infection Control at Rainbow Babies and Children's Hospital. Welcome, Dr. Edwards.
Hi, thanks for having me.
Dr. Edwards, we have a lot of data to assure us that these childhood vaccines I was discussing are both safe and effective. Could you speak a little bit more to that, especially because we know there is some concern among parents about potential adverse reactions to receiving one of these vaccines?
Yeah, I really appreciate you asking that specific question because I know right now there's a rumor going around or a thought going around. I don't really know what that vaccines don't undergo safety trials. I don't know who started that. I don't know why it's spreading, but that is not true. All vaccines that are approved for use by the FDA in the United States have to go through phase 1, phase 2, and phase 3 trials. And each of these 3 trials has a safety component to it. Furthermore, after a vaccine has been approved for use in the United States, it has what we call post-marketing or post-approval safety monitoring. Everybody knows about VAERS, but there's actually several different safety monitoring services for vaccine safety events, not just in the United States, but countries all over the world have vaccine safety monitoring services. And so we get pre-approval safety data from phase 1, phase 2, and phase 3 trials, and we get post-marketing safety data on vaccines. The most recent study that came from Denmark was published in July. It had over 1 million children in it. There are hundreds and hundreds and hundreds of other safety studies, both pre-approval and post-approval, that all uniformly show that vaccines are very, very, very safe. Most adverse events are things like, injection, pain at the site of injection, maybe some swelling, redness, low-grade fever. Even that is not universal. Most kids don't have side effects at all. And that very significant adverse effects that might require medical attention are exceedingly, exceedingly rare. Some in the range of, 1 to 100,000 shots, some one event per million or 100 million shots. So these vaccines are very, very safe, and they prevent very serious diseases.
Thank you. Let me turn now to the HPV vaccine. It's a vaccine that appears to be one that offers very clear benefits, appears that it has a substantial impact on reducing the risk of some cancers in both boys and girls later in their lives. Can you speak a little bit more both to the benefits of the vaccine as well as to its safety profile?
Yeah, the HPV vaccine is amazing. And in fact, you had mentioned its ability to prevent cervical cancer. Australia actually has one of the highest uptake rates of the HPV vaccine, and they are actually on track to eliminate cervical cancer by 2036. Eliminate. Like, I don't think anybody was expecting that, but it's amazing the effects that they're seeing. They have a very high vaccine rate coverage in Australia. So it is very, very effective, especially if it's given before exposure. That's, a lot of parents are like, well, can't we defer that vaccine till my kid is a little bit older? We actually prefer to give it young because that would be before exposure. The effectiveness is as high as 97% in preventing cancer if it's given before first exposure to the virus, the human papilloma virus. And so that's actually why the CDC and the ACIP, the Advisory Committee for Immunization Practices, opted to move the recommendation for when to start vaccinating to early, usually around like 8, 9 years of age. So that if its effectiveness is phenomenal. The data from all over the world, not just in the United States. I mean, states and countries that have higher uptake of this vaccine are just watching year on year cervical cancer rates. You talked about the oropharyngeal cancer rates drop and drop and drop, which is phenomenal. But then there's the safety question, and I know in particular the HPV vaccine has gotten something of a bad rap in the safety anti-vax world. I'm not sure exactly why that is. I don't know why people are so passionate about trying to prevent people from getting the HPV vaccine. But just as any vaccine would, the HPV vaccine went through phase 1, phase 2, and phase 3 trials prior to FDA approval. All 3 of those phases included safety monitoring. And so they monitored for adverse events. And then the HPV vaccine, as all vaccines do, has gone through multiple rounds of post-approval safety monitoring. And outside of what we talked about, injection pain, redness, swelling, the only safety signal that we've seen with the HPV vaccine is same-day syncope. So syncope is when you pass out, and we do see an increase in same-day syncope with the HPV vaccine. That's actually not a unique signal. We see it with all teenage vaccines. Teenagers are more prone to passing out than other age groups of people. It's for a host of developmental reasons. But we see with vaccination, or actually with blood draw as well, that teenagers struggle with same-day syncope. So it's not a unique feature of the HPV vaccine. We see it with the meningococcal vaccine. We see it with Tdap. We see it with blood draws, that tends to increase that risk of same-day syncope. You'll hear rumors about infertility. That is not true. In fact, the data shows that the HPV vaccine improves fertility because cervical cancer can decrease fertility because of the inability to carry a pregnancy to term. So actually vaccinated girls are more likely to be able to carry a pregnancy to term because they don't get cervical cancer. And then there's another rumor, I don't know how this one got started, that the HPV vaccine has killed teenagers. That is absolutely and categorically false. There is no teenager that has died from the HPV vaccine ever anywhere in the world. I want to make that very clear. So it's a very safe vaccine, and it is very effective, and it is most effective if given before potential exposure. So we do want to make sure parents are getting that for their kids when they're still young.
So Dr. Edwards, how do you approach having a conversation about the HPV vaccine with parents during an office visit? Given that it's a comparatively newer vaccine, and as with anything that's relatively newer on the scene, people may not be quite as familiar with it.
I think the first is the education piece, just letting people know. I don't think a lot of people understand that cervical cancer is related to this infection with human papillomavirus. I think people are very familiar with cervical cancer. It's one of the most common female cancers in the United States. Um, and so I think people know it exists. That's not the problem. But that link between cervical cancer and infection with a virus is something I think most people aren't really as familiar with. And so explaining that link, which of course you then have some guys shrugging their shoulders and being like, well, that's not me. But there are male cancers, including you mentioned the oropharyngeal cancers that are also associated with human papillomavirus. And so just explaining that by making you immune to this virus, it drastically reduces your chance of getting these cancers if you were unlucky enough to get infected with one of these strains that can cause cancer. And I think once you explain that link, people are like, oh, that makes so much sense. And so I think just explaining the link between the virus and the cancer is really that first step so that people understand why trying to prevent this virus from spreading is so important.
Well, thank you so much, Dr. Edwards. I really
Mhm.
appreciate that discussion. Well, before we wrap up today, I want to take some time to talk about some of the Ohio Department of Health's success stories over the past few years. Of course, we continue to face many challenges, and there always will be new ones. But with Governor DeWine's steadfast support of public health in Ohio, we can celebrate several meaningful wins just since 2021. First, the Trust for America's Health, a nonprofit group for the past 22 years, has been producing an annual report called Ready or Not: Protecting the Public's Health from Diseases, Disasters, and Bioterrorism. It's a measure of each state's preparedness. As the report indicates, public health must be ready at all times to respond to threats such as pandemics, but also to natural and man-made disasters such as tornadoes or chemical spills. In the 2020 and 2021 reports, which measured the years of 2019 and 2020, Ohio was, in fact, in the lowest of their three tiers. In the 2022 report, which measured our efforts in 2021, Ohio jumped all the way to the top tier, one of only three states to achieve that. And for the next 3 years, we have maintained our top tier rating. I'm very proud of that and how it reflects on the people in our department and our numerous partners around the state. For 4 years now, Ohio has been among the best in the country at health preparedness. Another indicator of state public health efforts paying off is that for the last 2 years, Ohio has seen a decline in drug overdose deaths that has outpaced the national average. The nation has seen a decline as well, it's true, which is wonderful. But in Ohio, in both 2022 and 2023, we outperformed national trends. In 2023, for example, Ohio had a 9% decline compared to a 5% nationwide decline. I believe this is a testament to Ohio's intense work in this arena, one directed by Governor DeWine and put into practice by numerous agencies, not just the Department of Health. Our major piece in the fight has been to ramp up distribution of naloxone, which saves lives and gives people another chance to enter into treatment and recovery. Preliminary data suggests that we may have had an even greater decline in the state's overdose deaths in 2024. That final report will be out sometime this fall. School-based health centers are another important but relatively new area of emphasis for the Ohio Department of Health. Research has shown that school-based health centers can improve students' health and also their academic success. It saves classroom seat time, meaning kids just don't miss as much school. Indeed, our data conservatively shows an average of nearly 3 hours of instruction time saved over going home or leaving to attend an appointment. Integrating into school buildings, school-based health centers allow easy access for students, staff, and the community. ODH began supporting school-based health centers in 2022, initially using federal COVID relief funding. We have since expanded on that support through state general revenue funding. With that funding, ODH, through the 2024-2025 school year, has supported school-based health centers in 49 school districts in 27 counties. These centers are bringing primary care services to a growing number of Ohioans. Just from April 1st of 24, when we started detailed tracking, through the end of that year, school-based health centers served more than 17,000 students and more than 6,500 adults. We continue to expand services at our existing school-based health centers and to open new ones. Just a few days ago, I was privileged to attend a ribbon cutting for a new center in Blair, Ohio. We're grateful for Governor DeWine's commitment to school-based health centers and to the legislature for continuing to support this important effort. I believe this is an innovative way to improve healthcare in Ohio, and often in some of our more underserved areas. And finally, Ohio C is a bold new initiative that began with Governor DeWine's 2024 State of the State address when he announced the formation of a Children's Vision Strike Force to see that Ohio students who fail a vision screening and are recommended for a follow-up exam actually get that exam, and if they need, a pair of glasses. Too many of our kids were not getting follow-up exams after failing a vision screening or the glasses they needed to be successful in school and life. ODH convened that strike force last year, and out of it came the program known as Ohio C, which the legislature funded in our most recent budget. We're working hard now to get the program up and running. Expect to see an announcement with more details on this coming very soon. I believe this program has the potential to put Ohio on the map as a leader in addressing children's vision needs early in their school years. These are just a few of the wins our department can point to over the past several years, and wins for ODH, of course, mean wins for Ohioans. Thank you. And Ken, I think we're ready to take questions people might have.
Okay, thank you, Dr. Vanderhoff. A reminder to please limit yourself to one question. Our first question today is from Katie Amrine from WKRC TV.
Thank you so much. I want to preface this by saying that my question is in relation to something different than child immunizations. So if you're unable to answer it, I completely understand.
Sure.
But I just wanted to know, how do you feel about the governor's push to make kratom a Schedule I controlled substance in the state, and what concerns do you have about the drug?
Okay, there's a lot there. I am very supportive of the governor in his actions. Let me just back up, I guess, a little bit and remind people of what kratom is. So it is a substance, a chemical that is derived from a tropical tree that is related to the coffee plant, and then it's often put into tablet or capsule form. At very low doses, people have used it as a stimulant or an energy booster, while at larger doses, it's been used for the self-treatment of pain, coughing, anxiety, and depression, and also used to self-treat withdrawal symptoms for people who may suffer from opiate use disorder. But we have to remember there are no drug products that contain kratom that are legally on the market in the US. Indeed, the FDA and many in the medical community have warned against using kratom at this time because it can cause very serious harm, and it hasn't been rigorously studied for safety and efficacy. In addition, the National Institute on Drug Abuse notes that while research is in fact underway, currently, kratom has not been found to be safe and effective. Kratom, though, is known to have real potential for harm. It can cause serious cardiac issues such as heart attacks, arrhythmia, and high blood pressure. It can also lead to liver toxicity, seizures. It can actually cause substance use disorder, as well as neonatal abstinence syndrome. And here in Ohio, we have seen a dramatic increase in the number of exposures to kratom that were reported to our poison control centers, mirroring a spike we're seeing across the nation. We saw 32 exposures in 2020. That number then more than doubled to an all-time high of 67 through the end of July this year, putting us on track for 115 by the end of 2025. That's a dramatic 259% increase over 2024. And our friends at the Poison Control Centers tell us that the majority of these cases are related to recreational use or an intent to use these products to treat other substance use disorders. In unintentional drug overdoses, we are also seeing a rising number of deaths where kratom was listed as a cause of death. Not the cause of death, but one of the causes of death. From 15 in 2019 to 37 in 2023. Combined with preliminary data from 2024, more than 200 deaths in Ohio since 2019 with kratom as a cause. Now, multiple states have banned kratom or restricted its access, and globally, it's illegal or restricted in parts of Europe, in Japan, and Russia. The bottom line for me is that kratom is a drug that can cause serious problems. And right now, there are much safer, better studied treatment options available today for conditions that people have turned to kratom for. So at this time, I'd encourage kratom users and anyone tempted to use the drug to please talk to your doctors and providers about safer options.
Thank you very much.
Okay, our next question comes from Celia Hack with Signal Cleveland.
Hi, thanks so much. I'm Celia, and I wanted to ask you, what is the guidance the Ohio Department of Health is advising on who should get the COVID vaccine this fall, especially for healthy children, healthy people under the age of 65, and pregnant women?
Well, thanks for that question. I know it has been on the minds of many people. So let me begin with where the Advisory Committee on Immunization Practices, the ACIP, is. They are expected to meet in September, and the CDC is then expected to publish their official recommendations for the COVID-19 vaccine for the upcoming respiratory season. That's this coming season, in the coming weeks. So I think we do need to look very attentively toward that. But based on current recommendations, for the 2024-2025 vaccine, so the one that's currently available to us, the CDC recommendations begin with adults ages 19 to 64 should receive 1 dose of the vaccine. Adults aged 65 and older should receive a 2nd dose to sustain their protection throughout the respiratory season. However, individuals who are immunocompromised may also need additional doses, but they recommend that individuals consult with their healthcare provider. Now, for children, the COVID-19 vaccine is currently available under a shared clinical decision-making model, which means that parents and guardians should have a conversation with their healthcare provider about what is right for their child. Now, along with that, the American Academy of Pediatrics recommends a COVID-19 vaccine for all infants and children ages 6 to 23 months, while they recommend that children and adolescents between 2 and 18 get a dose if they're at severe or a very high risk of severe COVID-19. As well as they recommend those who might be in long-term care settings, et cetera, get it, as well as some household contacts. So what this says to me is, look, for the moment, COVID-19 vaccines remain available. And as with so many other vaccines, this is a good time to talk to your provider about all of your child's vaccines and what the best recommendations for your child are in terms of receiving the vaccine. And we'll look forward to seeing what the recommendations that emerge from the ACIP for this coming fall are, knowing that they're receiving lots of inputs right now from multiple specialty organizations, including the American Academy of Pediatrics.
Okay, our next question comes from Karen Kassler, Ohio Public Media.
Hi, Dr. Vanderhoff and
Hi.
Dr. Edwards. Just wanted to ask Dr. Vanderhoff, and I don't know if you want to respond to this at all, but with the messaging that we're hearing from the White House and Washington, as well as some members of the Ohio legislature, are you concerned about any legislation that would offer people the opportunity to not take vaccines or in any way restrict or give that opportunity to people who are anti-vaccine?
Yeah, so right now there's a lot of discussions going on that relate to vaccines, and I really don't want to speculate about anything that right now is just in the realm of conversation. I think the message that I would have for people is the list of important routine vaccinations, most of which are given during childhood and adolescence, is a solid list of vaccines, most of which have been around for a long time, all of which have a very strong safety and efficacy track record and are offered because they help protect all of us from some very serious conditions that can have some very serious implications for people who remain unprotected from those. So, our message around vaccines has not changed. It continues to be one of confidence in our vaccines and one of a reminder about how important those vaccines have been in saving the American people, and especially the people of Ohio, from suffering from some very bad illnesses that previous generations were not protected from. I don't know, Dr. Edwards, if you have anything you would like to add to that.
Yeah, I would just say that, the American Academy of Pediatrics came out with a statement recently kind of reinforcing the vaccine schedule that has been the vaccine schedule for a while now. And that really, regardless of what comes down from federal or even state governments, that the American Academy of Pediatrics, of which I am a member and a fellow, stand by the safety and efficacy of all of our vaccines. And for the vast, vast, vast majority of children, being vaccinated is the right choice.
Thank you both. I appreciate it.
Okay, our final question today comes from Tanya O'Rourke with WCPO TV.
Hi everyone. Thanks so much for taking the question and doing this Zoom. It seems as if since COVID, there is a growing, or there grew a mistrust of immunizations, vaccines. One, is that true? And two, what or should the medical community do to combat that?
Well, I think that there has been a growing level of concern and in some cases distrust around vaccines, and a number of things have contributed to that. But first, in terms of what should the medical community do, I think we should be doing what we're doing right now, which is talking about the vaccines, laying out the case for those vaccines, both in terms of the important role they play in protecting us from some very bad diseases. And it's important, I think, for the medical community to remind people of the suffering and the not only suffering, but deaths that have resulted from so many of these vaccine-preventable illnesses, as well as the safety track record. And that safety track record, as Dr. Edwards shared earlier during our question and answer period, includes ongoing monitoring and very close ongoing study to assure that vaccines continue to demonstrate a strong safety profile. So, once these vaccines are released, we don't stop monitoring them. We continue to monitor them very closely and to assure that the vaccines that are being offered, in fact, are providing what all therapeutics should offer, which is vastly more benefit than risk that they share. So, Dr. Edwards, I don't know if there's anything you'd want to add to that.
Yeah, I think one of the things that has been shown in literature is that even as people become more mistrustful of institutions or programs, they continue to show high levels of trust in their individual providers. That data has been reproduced in study after study after study. So I think it is incumbent on us as physicians to be talking to our patients, to be listening to them. What are their concerns, helping them understand the data so that they can have their concerns addressed. I think there's a old kind of patriarchal, like, oh, the doctor said this is good and pat you on the head, so you should just do what the doctor says. And maybe for some people, because the doctor said so is enough. But I think, with the access to information that people have on the internet, and unfortunately the access to misinformation, really sitting down with our patients, listening to their concerns so that we can help them get the information they need to address those concerns is going to be the best way to limit vaccine hesitancy as much as possible.
Yeah, and I think one of the controversies that really began the degradation in broad confidence in the vaccines is one that started way back in the late 90s with a British physician who linked the MMR vaccine to autism. And he was later found to have falsified data and to have received funding from lawyers in lawsuits against vaccine manufacturers. And that paper was retracted by the journal that had published it, The Lancet, and he was barred from practicing medicine in Britain. And fortunately, and Dr. Paul Offit, who was on a press conference, I think about a year ago, spoke to this. Independent scientists have conducted more than 40 high-quality studies since 1998 that have involved well over 5 million people across 7 countries. And all of those studies found no connection between vaccines and autism. And these studies were rigorously designed and reviewed by independent peer reviewers. So, yeah, the reality is that we are seeing, and in numbers that I have shared about illnesses like pertussis and illnesses like measles and others, that these vaccines are highly protective. And when we have groups of people who might lack those vaccines, and those illnesses are reintroduced into our state, because look, global travel is a reality, and illness in one part of the world can find itself to Ohio very quickly. Sadly, we have seen whole groups of people contract these illnesses. We've seen individuals end up hospitalized, and we have seen, sadly, deaths. These are all avoidable, and that's what's tragic, because the vaccines that we have, the routine childhood vaccinations that we recommend, have been highly effective. They've been very safe.
Okay, we want to thank everyone again for joining us today. And Dr. Vanderhoff, do you have any closing remarks?
I want to thank Dr. Edwards again for joining us, and I want to thank those from the press who've joined us as well for listening to what we had to share, as well as for your very good questions.
All right, this will conclude today's press conference. Thank you.